Well, hello, Zenith family. This is Dr. Delali Hevi coming to you once again with another video in our series. And today's video is going to focus mainly on female hormones. Now, as you're all probably aware, because of restrictions placed on us by insurance, it's becoming increasingly difficult for us to really take the time to explain things during an office visit. And that's why it's become important for us to do these videos so that we can really do an in-depth but simple and easy to understand explanation of the way the human body works and different topics about health and things that you can do to improve your health. And we also like you to be aware of the rationale and the reasoning behind some of the things that we ask you to do. And so that being said, let me share my screen and we will get started. Today's video's format is a little different from the way we usually do the videos. And I would welcome any feedback you have because this is going to be more of a PowerPoint kind of presentation than the videos that we've done in the past. All right. So hormone therapy. Now, I would like you to note that today's video is mainly meant for patients who are here at the Zenith Health Institute. If you have been asked to watch this video, it's very likely that one of our providers has identified that you would be a good candidate for hormone therapy, and we just want you to learn a little more about it so that you can make an informed decision. All right. If you are not a Zenith Health patient, please make sure you consult your own healthcare practitioner before making any changes to your health. All right, so let's start by explaining what exactly hormones are, right? They're like a message delivery system in your body, and I like to explain it using a postal service as an analogy, right? So what postal workers do is they carry packages that contain information or messages all across the city, and they start from one person and go to an address or a target destination, right? The hormones are very much the same. They're produced by glands in the body. It could be the ovaries, it could be the adrenal gland that sits on top of the kidneys, it could be the testes, it could be the thyroid gland. You get the gist, right? They are produced in a gland, they go through your bloodstream to a target organ, and they give instructions to that target organ as to what it should do. And the intriguing thing about hormones is that they can have totally different effects on different organs. A typical good example would be the hormone adrenaline, right? And that's the hormone that kicks in whenever we are scared of something, have to get away from danger, or have to fight something. So supposing you were strolling in the African savannah, right? And then you encountered a lion that wanted to have you for lunch, you would turn around and start running. And your adrenal glands would produce adrenaline to help you get away from the danger. And so that same adrenaline, when it gets to your muscles, is going to help your muscles contract harder than usual. When it gets to your heart, it's going to make your heart pump harder than usual to get more blood flowing throughout your body. It's going to make your heart beat faster than usual. Once again, to get more blood flowing to the essential organs, which are your muscles at that point in time. There's increased blood flow to your brain. Your brain is going to be more focused. Adrenaline, when it gets to your eyes, is going to make your pupils dilate to help you see better and navigate the places you have to pass through to get away from the danger. And it's actually going to tighten the blood vessels going to your intestines because digestion is not a crucial issue when you're trying to get away from a lion. So it'll divert blood flow from your internal organs outwards to your muscles, your heart, your brain, and other things. So that's just one example of the way hormones work in the body. Now, when it comes to symptoms that people may have, they can be random when it comes to the female hormones, but we who are trained are able to pick up some of the patterns, right? So there could be an issue with energy, an issue with brain fog or forgetfulness. Moods could be swinging. Sleep could become a big challenge. And some women get hot flashes or flushing, and there could be changes in skin texture, there could be hair loss, low libido, and all sorts of other symptoms. Now, the four major female hormones are estrogen, progesterone, DHEA, and testosterone. And indeed, there are some more, but these are the big hitters when it comes to this. Now, estrogen is often thought of as a purely reproductive hormone, right? But indeed, there are receptors for all of these hormones in every single cell in the body. And so it's really oversimplistic to feel that hormones are only important for reproduction, and therefore, once a woman leaves reproductive age, it's perfectly okay for her to not have any hormones. That's totally wrong. When estrogen becomes unstable or starts to decline, some of the symptoms can be irregularities in the menstrual cycle, bone density starts to drop, brain function and memory starts to become an issue, and cardiovascular health also starts to suffer. Progesterone is known as the calming hormone, and therefore issues with progesterone can lead to mood issues, anxiety, stress, sleep difficulty, and balances between progesterone and estrogen can also affect weight. DHEA is a hormone that's produced in the adrenal gland that can also help us be more resilient when it comes to stress. And DHEA can also be converted into estrogen or testosterone depending on the body's requirements or needs. And finally, the fourth one we'll be looking at is testosterone. And testosterone is known commonly as a male hormone, right? But women need it too. And it helps with motivation, with focus, it helps with muscle tone and building because as we get older, we tend to experience some muscle loss. It's testosterone that's really going to help us to maintain that muscle and in some instances even build back what we have lost. Now, there are two major patterns that we see when it comes to hormone imbalances. The first one is relative estrogen dominance, and that's when you either have too much estrogen or too little progesterone, or a combination of both. Bottom line, there is a discrepancy between the balance between estrogen and progesterone. And make note of the fact that we do not treat lab numbers just in isolation, right? We look at the ratio in the context of the clinical picture of the patient sitting in front of us. Because sometimes numbers could look normal at face value, but could give us clues that there is really something going on beneath the surface that needs to be addressed. So estrogen dominance can have several different symptoms. A woman may experience bloating, breast tenderness, headaches, heavy or irregular periods, mood swings, weight gain and difficulty losing weight, acne, cysts and fibroids, because this tends to predispose women to cyst formation all over the body. The second major pattern we see is ovarian shutdown, which occurs during menopause. And as you're probably aware, menopause is defined as having 12 consecutive months without a period. Now, menopause symptoms can vary very widely. You can have the hot flashes and night sweats, which are prototypical presentations of menopause. There are sleep difficulties, cognitive and memory difficulties. There could be issues with recurrent bladder infections, vaginal dryness, discomfort during intimacy. Skin texture can be affected, hair can start to thin, and there may be some long-term risks. And these are things that you actually may not feel, but things like reduction in bone density that can lead to osteoporosis. And there's also an imperceptible increase in risk of heart disease if the hormones are out of balance. And in the modern day, because there are so many other factors at play, the symptoms tend to be more pronounced than in the past when people had totally different lifestyles, right? In the present day, there is chronic stress everywhere you pass. It's difficult to get a good night's sleep. There are processed foods that have all sorts of chemicals and endocrine or hormone disruptors in them. We are surrounded by chemical and environmental toxins, and this leads to less recovery time for our nervous systems when we are in a persistently stressed state. And so we always like to emphasize that lifestyle is the foundation of any intervention to help you start to feel better. And so sleep is very important. Nutrition, make sure you're getting whole foods with minimal chemicals added to it. Physical activity is very important, especially strength training, and managing stress is crucial to general health, but also normal hormone balance. Now, why is it important to use hormone therapy when it is appropriate? So, hormone therapy is a tool, right? Remember, it's not a shortcut. And there are certain situations where lifestyle changes alone are not enough to get you feeling better. And sometimes also you need something to help give you some quick relief first so that you can actually sleep, move, eat well, and rebuild your health with consistency. And sometimes once you're able to do that through the hormone therapy, you'll get to a point where your hormones start to balance themselves out on their own, and then you can come off of the hormone therapy. Now, there are many different forms of the compounded hormones, but the ones we have found to be the most popular and probably the most effective are lozenges that you put under the tongue and creams that you apply to the skin that gets absorbed. And between these two, we have found that the lozenges tend to be the most effective. Now, let's talk about the word bioidentical. What does that actually mean? So bioidentical means that the molecular structure of the hormone is chemically identical to what your own body would have naturally produced. And if you think about a key, a lock, and a lock system, right, you need the key to fit exactly into the lock in order for it to open. And bioidentical hormones tend to fit perfectly into the hormone receptors in our bodies in order to exert the action. Other substances may have a small tweak that changes the molecular structure a little bit, and therefore you don't get that perfect fit. And you may have some response, but it's not a full and adequate response. And there may also be some unwanted effects that are generated. So the bottom line is bioidentical describes the molecule, and it's not a guarantee of the response you're going to have. What really makes the therapy safe is the process and getting the right hormone at the right dose for the right person with the right follow-up. Now let's address the big C question, right? And let's set the record straight because the most common question or the fear that patients have is that of getting cancer from the hormone therapy. Now, it's important to understand that the Women's Health Initiative was a study done in 1991 that was grossly misinterpreted and which caused a huge uproar in the medical community because the interpretation at that time was that hormone therapy was giving women cancer, right? But that has been re-evaluated and re-studied, and it has been identified that the way the data was interpreted was wrong. And because of that, the FDA has actually removed the black box warning that was placed on hormone therapy many years ago. All right. And one thing that rarely gets discussed about hormones also is the fact that when your hormones are out of balance, just that in and of itself can also increase your risk of getting certain cancers. And therefore, restoring that normal balance to the hormones is actually going to reduce your risk of getting cancer. And this is commonly seen mostly in like estrogen dominance. But even women who have hit menopause and whose hormones have completely tanked, it's been proven that in that scenario also there is an increase in insulin resistance. And insulin resistance is a well-known risk factor for development of certain cancers. So the bottom line is the fear of hormone therapy and cancer was largely based on flawed science that was applied to the wrong type of hormones. And bioidentical therapy, which is properly dosed and properly monitored, is not the villain it was made out to be. And leaving hormones unbalanced carries its own serious risks as well. Now let's take a patient case study. And of course, this is not a real picture and it's not the real name of the patient we're talking about. But Sarah, 38-year-old professional woman who came to us very frustrated. She ate very well and exercised regularly, but she started developing hot flashes. She was gaining weight, even though she did not change anything in her regimen of eating and exercise. And she started to develop weird mood swings that were concerning for her and, of course, her husband as well. Now, lab results revealed that her estrogen, progesterone, testosterone, and the DHEA levels were all significantly below optimal range, which is a pattern we see very frequently in perimenopausal and menopausal women. And so, based on those results, we developed a personalized therapy for her which worked well. Her words were they were a miracle, right? The hot flashes went away, her weight stabilized, and she went back down to her baseline weight and was able to stay there. And her mood lifted, which was wonderful. Now, Sarah's case actually is not unique. Many of our patients experience similar transformations when we do proper balancing of their hormones. So this is a breakdown of the treatment process here at Zenith. So there's an initial evaluation here in the office. If it is identified that you would benefit and you agree to proceed, we will send a prescription to the compounding pharmacy. Then that pharmacy will contact you to confirm shipping and payment. And then within about 2 to 3 business days, the compound will be done. Now, for those of you who may not be familiar with compounding pharmacies, they are a bit different from the regular pharmacies that mainly retail drugs, right? Compounding pharmacies have the ability on site to formulate, and they have all the raw materials, and so they can mix and match with whatever proportions are required. Again, they can do pills, they can do creams, they can do capsules, they can do lozenges. Now, our preferred compounding pharmacy is one that's local. It's called Pharmaprodia. We work with them for several key reasons. We can vouch for the quality of the products that they have. Their lead pharmacist has a doctorate degree in hormone replacement, which is amazing, and it's located close by. Now, I have to mention we have no financial ties to Pharmaprodia. We have no ownership in Pharmaprodia. And while we highly recommend them, we will gladly send your prescription to a different pharmacy if you request it. We just cannot guarantee the quality and the outcomes from sending it to a different pharmacy. Okay? When it comes to monitoring and dose adjustments, this is what you should expect. We tend to do blood work every 3 months in the beginning, and as things stabilize, right, the interval out to a lot longer, it could be 6 months, sometimes even yearly. But hormones are very tricky, right? And they can be affected by so many different things. And so in the beginning, there usually is a time frame between initial therapy and complete balance of the hormones. And so don't be discouraged if the dose changes periodically. That's just the way hormones are. And another important rule is we encourage you to do blood work at least 3 weeks before the follow-up visit so that there's enough time for us to get the results of that blood work back, discuss the results in the context of the way you're feeling, and then have enough time to send a new prescription out and have you get that new prescription before you totally run out of your current batch. Another question we commonly get asked is, when will I start seeing the changes? And this varies from person to person, but in general, usually within weeks 2 to 6, people start to see improvements in their sleep, their mood, the hot flashes, and energy. From months 1 to 3, there tend to be clearer and more consistent improvements across the board. And the very first dose adjustments happen based on labs and the feedback that you give us. And in months 3 to 6, there is continued optimization. That's usually when like composition and weight improvements start to kick in. Libido will start to improve. Cognitive and brain function will also start to improve. And then, of course, there are the long-term benefits, which are for bone health, cardiovascular health, and brain health as well. Please remember this timeline varies by individual. Now, here are some common mistakes to avoid. Number one, expecting overnight magic, right? Hormones are complicated and they take a long time to reach stable levels. And so please be patient with your protocol. Number two, it's very important that you take the hormones consistently because it's when you do that that you really see the benefits. And that's also how we'll be able to adjust your therapy appropriately. And please try and avoid last minute refill requests because that can be hard at times to manage because it's really, really important that we look at not just the numbers on your blood results, but also have a discussion with you to understand your symptoms and put those two things together. And so when is there a concern, right? Hormones, as I said earlier, when done right, is very safe, but if you experience any unusual bleeding or severe or heavy bleeding, or experience severe mood changes, or anything that just doesn't feel right, please do not hesitate to reach out. Do not wait until your next appointment to do that. That being said, also, one of the most common symptoms that women get is breast engorgement and could be associated with some pain or tenderness. This usually goes away after a few days. It's a very common natural reaction of the body to the new levels of hormones. So don't freak out if it happens. But of course, if the pain is unbearable or persists for weeks, please let us know. And the final important note, while hormone balancing is a powerful tool for optimizing health, it's very important to understand that it's a therapy that's done within a much broader context of wellness, right? Hormone therapy reduces risk, but it does not completely eliminate it. And that's because for things like cancer, for instance, there are so many other things that can also cause cancer. And so if you don't tackle those other things, doing hormone therapy alone is not going to take away that risk. Lifestyle plays a very vital role. And so, as we discussed earlier on, stress management, food and nutrition, environmental exposure, all play a very important role in risk for chronic disease. Okay. It's important to embrace a holistic approach. And finally, I would like to conclude by letting you know that your body is not broken. It is just asking for normal balance. And that's what we do here. We will personalize your therapy, we will monitor you carefully, and we will adjust as things evolve. Our goal is simple, for you to feel like you again, with energy, clarity, and confidence, and supported by a safe, thoughtful, and personalized plan. Thank you for taking the time to watch and learn this presentation. I would just like to state once again that this is not general medical advice. This is wishing you all the best in your journey towards better health. Take care and bye.